Good afternoon, everyone. I'm Ahna Minge, State Budget Director at Minnesota Management and Budget. Today, I will be walking through changes in the state expenditure forecast. And then I'll turn it to the Commissioner, who will walk through our long-term budget outlook. So this slide outlines anticipated changes in general fund spending in the current biennium, as well as our planning years of 2028 and 2029. In total, we project that spending in the current biennium will be $68 million lower than our previous estimates, but the planning estimates have increased by $152 million since our last forecast. Let me walk you through the table to give a better sense of what's driving that change. The first line, E12 education, spending is above prior estimates by $111 million this biennium and $257 million in the next. These increases are a result of higher spending for special education, where costs have grown as school districts spend more to deliver services to our students. Health and Human Services spending is projected to be $162 million below previous estimates this biennium and $199 million lower in the next. This reduction is largely driven by the implementation of new payment review processes in the Medical Assistance Program, which I will discuss in greater detail in a moment. On the next line, you can see the property tax aids and credit spending is $18 million below previous estimates in this biennium, largely as a result of lower spending on property tax refunds. Spending for debt service and all other areas of the budget are virtually unchanged from previous estimates. On the next line, you can see that our forecast includes an estimate of discretionary inflation. We estimate this cost to be $1.04 billion, which is $104 million more than we forecast in November. This change is due to a slightly higher forecast for the Consumer Price Index, which can have a large budgetary impact because it's applied on such a large base of spending. As a reminder, this number is not meant to be a specific accounting every single inflationary pressure in the budget. Rather, it is a guide for policymakers about the cost of maintaining current services as prices grow. Any increases need to be appropriated by the legislature. They don't automatically flow to state programs unless the program has a specific statutory formula that directs it. So policymakers have the choice whether or not to spend this line item to address those inflationary pressures. So now let's move on to the next slide to discuss some key changes within our spending forecast. As you just heard, special ed is responsible for the upward revision in our education forecast. These costs have increased by $112 million this biennium and $350 million in the next relative to where we were in November. That is on top of the significant increases that we incorporated in the November forecast of $133 million in 26-27 and $287 million in 2028 and 2029. Today's increases are because we now have complete data about what schools spent on special ed services in the 2024-25 school year. Special ed service spending grew by about 10% last year compared to the 6% that we assumed would grow in the previous forecast. The annual rate of growth for school special ed spending has grown significant in recent years, driving revisions in the state forecast. So the chart on this slide shows actual and forecast state general fund special ed spending from 2020 through 2029. During this time period, we project that special ed spending is projected to grow from $1.6 billion in 2020 to $3.6 billion in 2029. When you look at that on an annual growth perspective, from 2020 through 2023, state general fund spending on special ed grew about 5% on average annually, but from 25 through 29, that rate grows to about 9.5% a year. Some of the changes can be attributed to legislative changes that affect special ed, but overall growth in local education agency spending continues to rise forecast over forecast. And that's really evident on this slide when you look at the previous forecast that we have marked in those dotted and dashed lines. You can see from the end of the 2023 legislative session is the bottom line, then the end of the 2025 legislative session, and finally November 2025 session. So in each of these cases, we've revised our forecast upward to account for higher actual spending sort of at the local level. Now let's move on and talk about a driver of the change in the human services forecast. So this forecast is the first to incorporate the experience that we have with the new prepayment review process for certain medical assistance benefits. In late October 2025, the Minnesota Department of Human Services announced a new process to suspend and review claims for 14 high-risk Medicaid benefits. This was intended to give the agency additional time to identify suspicious patterns and anomalies. DHS contracted with a third party for this review and has established an ongoing prepayment review process for these services. This process has impacted the forecast in three ways, which are sort of depicted in the chart on the screen. So what the chart shows is the forecast savings attributable to the prepayment review process. The most immediate impact, in the dark blue on the slide, is the delay in the payment of fee-for-service claims of 2 weeks. This additional review takes time, and as a result, the claims are paid just one billing cycle later than they would have otherwise. And because everything is pushed out by 2 weeks, there is just a one-time savings reflected in the forecast. But the most significant impact of the prepayment review process comes from the fact that we are receiving fewer bills from providers. Some have referred to this as cost avoidance. Through an analysis of claims from both before and during the implementation of prepayment review, DHS estimates about 4% lower spending in these 14 services as a result of providers simply billing less. This cost avoidance is expected to decrease state spending by $75 million this biennium and $99 million in the next. This estimate is based on actual experience in the most recent quarter, and it's not an explicit measure of fraud. It may indicate that there's a deterrent effect of the new prepayment review process, but it might also be capturing savings related to broader conditions in both the service delivery sector or the broader economy. The third forecast impact of the prepayment review process is the denial of claims that would have been otherwise paid if not for the review. In this process, claims for the impacted benefits are reviewed using targeted analytics and then flagged if suspicious. So if a claim is identified for further review, it's sent to DHS staff who reviews it and decides either to approve or deny. Based on early data, DHS projects an increase in denials, which reduces state spending by $5 to $6 million a biennium. So in total, the incorporation of this experience lowers the spending forecast by $133 million this biennium and $105 million in the next. So now let's move on and talk about something that is not in the forecast. So as we've discussed in previous forecasts, federal funds are a very important piece of the state budget. Federal funds make up about 1 in every $3 spent by state agencies. What MMB pays particular attention to, though, are federal funds that support state-level entitlements, programs where the state has an obligation under our laws to provide service to individuals regardless of federal funding levels. We estimate these dollars make up about 2/3 of the funds we receive from the federal government. In these cases, losses of federal funds create a direct budgetary impact to the state. Federal funding for entitlement programs has been more volatile in recent months as a result of both federal law changes and administrative action, and there are several risks that are not reflected in today's forecast. One example is related to actions taken by the Centers for Medicare and Medicaid Services, also referred to as CMS, which is the federal agency overseeing Medicaid. On January 6th, CMS indicated their intent to withhold $515 million per quarter from the state's MA reimbursement. That action is currently pending appeal, and the loss of federal funds is not reflected in our estimates today. And now just earlier this week, we received additional notice from CMS that they would defer $260 million of our Medicaid reimbursements pending further information from the state to justify claims that they flagged. There is also budgetary risk from the fact that some of our state laws do not comply with federal law that passed over the summer. Specifically, H.R. 1, the Federal Reconciliation Bill, made a number of changes, some of which must be implemented by January 1st of 2027. An example of that would be work reporting requirements for Medicaid. If state law is not amended to comply with this change, we stand to lose significant federal funds supporting this program. Unfortunately, we don't have the guidance today to quantify the magnitude of this risk, but we understand that it could be significant and could change our budget outlook. There have also been recent attempts by the federal government to freeze funds supporting child care benefits and MFIP. And although none of these impacts are currently reflected, if they occur, it could dramatically alter our current budget outlook. With that, I'll turn it back to Commissioner Campbell.